Hello everyone, I'm Dr. Prasad Puthiyillam, continuing my class series on scientific foundations of health. This particular class video I'm discussing about avoiding risk and harmful habits. So the topic include health compromising behavior, types of addiction, recognizing an addiction, characteristics of health compromising behaviors, development of addiction and addictive behavior or influencing factors of addiction, differences between addictive people and non-addictive people and their behavior with society, effects and health hazards from addiction, how to recover from addictions. All these are available in my YouTube channel, My Intuition. Please do subscribe and support me. Now, health compromising behavior. Health compromising behavior, that health compromising behavior are habitual and hence difficult to treat. The addictive behavior occurs when a substance or activity or behavior becomes the main focus of an individual's life, resulting in physical, mental, or social harm to themselves or others. A person can become addicted to dependent, or it can be addicted or become dependent on anything. The term addiction is used to solely indicate the psychoactive substances that cross the barrier between the body and the brain to temporarily alter the brain's chemical balance. It could include the tobacco, alcohol, or some drugs. Nowadays, a significant amount of psychologists and healthcare professionals insist that the psychological dependency, such as with a smartphone or sex or gambling or work, should be considered as addiction as well, since they also cause feelings of shame, guilt, failure, despair, anxiety, hopelessness, and humiliation. When an individual becomes addicted to something, they start to become dependent on it and need to keep repeating the activities, taking the drug or drinking alcohol, or despite the negative consequences these behaviors bring. Types of addiction. There are mainly two types of addiction, namely the physical addiction or substance addiction, and the second one, that is behavior addiction. So first one, that is physical addiction. Physical addiction, it can generally be grouped into three main categories, that is alcohol or illicit drugs and prescription drugs. So the first one, alcohol addiction, or the people who are addicted to alcohol, or they do not have any control over what they are doing. Using it means they are not, they have the dependency on alcohol, uh, which is the most common form of the physical or substance addiction. They drink continuously the alcohol or regular consumption of heavy drinking. Alcohol addiction often starts with the social drinking and then progresses further and further until one find himself dealing with an unbreakable addiction. The second one, that is illicit drugs. Illicit drugs addiction is an addiction to the illegal substances that causes a short-term disruption in the brain, resulting in an altered perception of reality. The illegal drugs can cause long-term changes to the brain and other organs, leading to severe addiction. Third one, that is using the prescription drugs, no control over the prescription drugs. The prescription drug addiction, it is usually approved by using the approved medication in a way such that it is not prescribed by the doctor, and this become increasingly problematic nowadays. People are using the drugs without the prescription of doctor. Second one, that is behavioral addiction. Behavioral addiction is in which people are always tempted to be addicted not to the alcohol or illicit drugs or prescribed drugs, but some situations or conditions like food addiction, internet addiction, using computers or cell phones, video game addiction, pornography addiction, work addiction, exercise addiction, a spiritual obsession, which should not be confused with the religious devotion, then shopping addiction, gambling addiction, etc. Now, the physical addiction or substance addiction and the behavioral addiction, they are always linked together. Even in the physical addiction or substance addiction, over half of those are suffering from the substance addiction are also using some other substances also. So these are having both this physical and behavior addiction effect with the development of addiction can include the financial issues, destructive behavior, relationship issues, family conflict, and negative feeling that come up as a result of these addictions. Now, how to recognize an addiction? Recognize an addiction problem is with someone whom we know is very difficult or it's very hard than it seems. No matter the type of addiction, it is important to recognize the warning signs and seek help if necessary. So we can identify in the initial stage. In the early stage, a person might not show observable signs of a fully blown addiction, but some early stage clues include the experimentation, family history of addiction, being particularly drawn to an activity or substance, seeking out situations where the substance or activity is present, a loss of control with little to no feeling of after the or uh, no feeling of regret after using that. When it comes to the common social behavior like drinking or smoking, it might be difficult to determine if there is an addiction problem. But what looks like addiction could be an experimental phase or a form of stress management. But a real addiction, if left untreated, can be developed into a habit or increased risk of illness. Now, look for changes in personality. Once we start getting addicted, there will be an observable signs which include a lack of interest in hobbies or activities that used to do that was important once. Then neglecting the relationships of or reacting negatively to those closest to them, missing the important obligations like the work, risk taking tendencies, especially to get the drugs or continue certain such behaviors, ignoring the negative consequences of their action, a distinct change in sleeping patterns that result in chronic fatigue, and increased secrecy like lying about the amount of substance used or the time spent for that. We may notice an increase in this behavior over the time. People with an addiction tend to surround themselves with others who encourage their habits. That when confronted, they may make excuses and try to justify their behavior to us. With health, look for the changes in health. Another way to recognize the addiction is to pay attention to the person whom we feel are getting addicted, observing their mental and physical health. Whether the addiction is to a drug or behavior, their health will almost always decline. The signs that point towards changes in their health can include bloodshot eye or glazed eye, constant illness, unexplained injuries, abrupt changes in weight, bad skin, hair, teeth, and nails, then increased tolerance to the drugs, physical withdrawal symptoms like sweating and trembling or vomiting, memory loss of or problems with recall, a change in speech like slurred words or a rapid rambling. Mental and emotional changes are also visible. Some of the visible changes are like sudden change in mood, aggressive behavior, irritability, depression, apathy, then suicidal thoughts. Now, so what are the characteristics of a health compromising behavior? The presence of addiction behavior can be identified by the characteristics of a health compromising behavior. Some of the most common characteristics include which include that the individual cannot stop taking the substance. Even oftentimes the person who is addicted, he'll try to stop addiction at least once, but they fail in that. The health problems do not stop their addiction. The person keeps taking the substance as usual, despite having developed illness connected to it. For example, an alcohol addict may keep drinking even after finding out they have liver disease. Giving up recreational and or social activities. Addiction can cause some people to give up or not become involved in activities. For example, an internet addict, he choose not to go for a camping if he knows that there will not be internet access. Or an alcoholic, he will avoid long trips when he knows that there is no access to alcohol. Fourth point, keeping a steady supply. Individuals who are addicted to a substance will always have enough of it around, regardless the amount of money they have to ensure that they have a good supply of that additive substance. Saving stashes. The addicted people always tend to keep some stashes, small stashes of their substance hidden away in various locations, such as throughout in their house or in car. Risky behavior. Sometimes the addicted person may engage in risky behavior to ensure that they get the substance of their choice, even such as stealing. Or on the other hand, an addict who is under the influence of substance may engage in risky activities like reckless driving, excessive consumption. With some addictions like alcohol and certain drugs, an addict may consume it to excess. This can result in physical symptoms or blackouts where they cannot remember anything for a certain amount of time. Dealing with the issues. An addicted individual often feels that they cannot deal with their problems without their drug of choice. So they often abuse the substance as a way to self-medicate. Then obsessing. An addicted individual may spend increasingly more time and energy thinking of ways that can which they can get more of their substance or even other ways they can use it. Secrecy and denial. Many addicts take their substance on their own as well as without anyone knowing about it. If someone confronts, if they identify and try to advise them about their use, they either refuse to acknowledge or are not aware that they are addicted. Having troubles with the law. The addicted people always run into problems with the law uh, for the risk they are taking, or they involve in such activity to get some such type of drugs which are illegal. Financial problems. If a substance is costly, the substance which is gives the addiction behavior, if it is costly and they are addicted, the person may sacrifice their budget to get that item and secure it. Relationship issues. Addicts often have relationship issues due to their secrecy, which can lead to trust issues. As the relationship deteriorate, violence, anger, and emotional abuse often become concern. Now, development of addiction and addiction behavior or influencing factors of addiction. Addiction is unlike most other disorder. The condition progresses and develops over time. For most sufferers, most people who are addicted, it starts as an experimentation out of the peer pressure or curiosity. While for some others, it can be a coping mechanism to deal with the stress, anxiety, and sadness. There are no specific cause for the disorder, only certain influencing factors. Some of the most influencing factors, which include the genetics, environment, neurology, mental disorders, and genders. The first point, that is genetics. Genetics, it is regarded as one of the major influencing factor for addiction. This means that if someone has a parent or sibling or the first degree relative who is a substance or behavior addict, then it is likely that they may become addicted as well as the disorder runs in family. The genetic vulnerability was transferred equally from father to mother to the children. Then second one, that is the environment. Environment, certain environmental factors can also increase the risk of developing an addiction. It refers to the people, environment, or location, or even events then stressors, the experiences, risk factors if a person is exposed to during their life can influence their mindset. It has been observed that the this following uh, can also influence, like family environment, the home environment, and parental supervision plays a crucial role, especially during adolescence and young adulthood. Usually, parents will guide the young adulthood or the adolescence age to not to involved in such addiction, or what are the ill effects of getting involved into that. Children who grow up in dysfunctional or toxic families and experience frequent abuse or domestic violence, financial issues, adverse childhood experiences, maltreatment or abandonment, then neglect from parents, or even lack of parental discipline and or excess control may be more likely to become addicts. Moreover, the single parent status of family may influence the substances in teens and adolescents. Then addicted parents. Children with parents who are addicted to a certain substance or behavior are also at a risk of becoming addicts of themselves. Watching parents or the older sibling or family member and other relatives which are using the drug or alcohol engagement or in any criminal activity or negative behavior can make children and the adolescents prone to experimenting with the drugs and alcohol. Moreover, some parents may even encourage their children, but it is extremely rare. Peer pressure. The influence from our friends or acquaintances can leave a significant impact on the teens and adolescents and encourage them to try out substance or alcohol or smoking. Friends who are addicted to substances or behavior can persuade non-users to experiment and influence their judgment and decisions. Availability and accessibility. The easy availability of the substance in the community or in neighborhood or at home or school is another significant environmental risk factor which can lead to addiction. When an individual is repeatedly exposed to substance or alcohol or smoking, they feel encouraged to experiment and eventually become regular user. The third point, that is neurobiology. Neurobiology always or also plays a vital role in development of addiction when present along with genetic susceptibility and environmental risk factors. Stress is strongly associated with addiction, vulnerability, and relapse. Uh, the addictive substance can adversely affect the neurotransmitters like dopamine. As the neurotransmitters become compromised and become unable to function properly, the tolerance will develop, which leads to the addiction. Mental disorders. Mental health conditions are often strongly associated with addiction. Psychiatric disorders such as bipolar disorder, anxiety disorder, and depression can increase the likelihood of an individual becoming addicted to alcohol or prescription drugs or other substances in an attempt to self-medicate. Individuals are suffering from mental health problems such as anxiety and depression may feel encouraged to look for an escape from their difficult emotions and can resort to drugs and alcohols. A fifth point, that is gender. The male gender is more at risk of developing an addiction than the female gender. Women are typically less likely to become addicted to substance and alcohol than men. But however, when men are more prone to suffering from a substance use disorder, women are more susceptible to psychosocial and clinical effects of alcohol and some other substances. Moreover, women usually abuse drugs at a lower dose than do males. The differences between addictive people and non-addictive people and their behavior with the society. A common misconception surrounding addiction is that uh, it solely affects the life of the addicted person. However, the idea that they are not hurting anyone except for themselves is just an excuse put forth or justifying their addiction behavior. Addiction is not one person's phenomena, and it creates a domino effect on lives of those around them, and it is a social problem. What are the effects of addiction? At first glance, the addiction may not feel affecting others, so it's only affecting that person, but actually it is not affecting, not only affecting themselves, it is affecting the society also. uh, an individual neglecting their responsibility as a result of addiction can negatively affect their career, their children's education, or the family's financial security. Their impact can also extend outside of the immediate family. Friends or community members who rely on their presence or companionship suffer from this, their absence. Addiction and crime. There is a definitive link between crime and addiction. Not only is it illegal to carry many of the drugs, but an individual's lowered inhibitions when under the influence can encourage them to commit other crimes. The types of crime that an individual may commit when on drugs are extensive and dependent on a variety of sub-factors. But regardless, drug users are more likely than non-users to commit a crime. Other complications of drug addiction, getting a communicable disease, like people who are addicted to a drug are more likely to get an infectious disease such as HIV, either through unsafe sex or by sharing the needles that they use to get the drug injected. Other health problems. Drug addiction can lead to a range of both short-term as well as long-term mental and physical health problems, which depends upon what drug is consumed. Accidents. People who are addicted to drugs are more likely to drive or do other dangerous activities while under the influence of the drug or the substance. Suicide. People who are addicted to drugs, they die or by suicide more often than people who are in addicted. Family problems. Behavior changes may cause the marriage, marital or family conflict, and custody issues. Work issues. During the drug use can cause declining performance at work, absenteeism, and the eventual loss of employment. Problems at school. Drug use can negatively affect academic performances and motivation to excel in school. Be only motivated towards the addiction. Legal issues. Legal problems are common for drugs, for drug users, and can stem from buying or possessing illegal drugs, stealing to support the drug addiction, driving while under the influence of drugs or alcohol, or disputes over child custody. Financial problems. Spending money to support drug use, take away money from other needs, could lead to the debt and can lead to illegal or unethical behaviors. Effects on health hazards from addiction. The long-term life consequences discussing. In the middle or later stage of an addiction, the negative effects will be more permanent or have long-term consequences. Someone with a serious addiction problem may allow or ignore or trivialize these outcomes in favor of continuing their habits. The potential long-term consequences include getting an infection disease, especially through shared needles, dropping out of school or getting poor grades, damage relationship with the friends and family, loss of good standing or tarnished reputation, arrests or jail time, eviction from the home or failed mortgage payments, loss of job, loss of parental rights. Similar events can occur in the lives of people without an addiction problem, but these can become more common when an addiction is present. Before approaching someone we think may have an addiction, determine if the problem is a result of single incident or a growing problem with the addiction. Now, how to recover from addiction? How to recovery from addiction? Many methods suggested by the people who are experienced with that, or those who give the solution. They avoiding addiction triggers. Many people learn through treatment that addiction it does not have to be a life sentence. It takes a constant management and a keen sense of awareness to maintain a non-addictive state. one has to take a look at some of the most common addiction triggers and consider how to avoid them. That is, identify our triggers. Each person's trigger are unique. For some people, getting high or drunk is the direct result of stress. For others, it is the result of just being in the vicinity of a club. Ask ourselves, uh, when do I think about drugs or alcohol the most? Which situations make me more likely to abuse a substance? What do using substance give me? Stress release, the ability to forget about responsibilities. Once we identify what the triggers are, we can then begin to play a way around them. In other words, we can learn to identify a trigger situation when it occurs and take steps right at that moment to move from the risk. Avoid stress. Many people face stress daily. At work, school, and at home, we may feel the stress begin to creep up throughout the day. There is no way to eliminate all stress from our life regularly. However, we can learn to recognize when stress is building. Our shoulders tense up, or our head is pounding. All we can think about is getting out of the situation. When the when the stress trigger builds, take action at that moment to minimize it. We can take a deep breath or close our eyes and counting from 0 to 100 or 0 to 10. Doing something that we enjoy, going for a walk or a swim or listen to music or some workout. The stress becomes when stress becomes too much, then we're going to gym to use exercise as a tool for getting rid of the tension. Pull others from for help. For some people, addiction triggers relate specifically to people. Being around the actions of one person can cause us to lose track. When a person or a person's action is causing us to feel the trigger building, recognize the need to turn to someone for help. Whether we need to reach out for support from our addiction treatment center or our spouse or a close friend, or we have to wait to get the guidance and help. Stay busy and motivated. One common trigger that is hard to avoid is boredom. We have to we have nothing to do. That is that boredom means we don't want to watch TV and there is no one to spend time with us. This scenario is common for those working towards reintroducing themselves to daily life after treatment. Staying busy helps keep our minds focused on the task at hand. Keep learning. The more we know about our addiction, the recovery process, and the triggers present throughout our day, the more powerful we are at taking steps to avoid them. Learn to improve communication with those we love. Work continuously on building strong relationships. Then explore new opportunities in every facet of the life. We can learn new hobby, explore a new career, take a step towards a meaningful relationship, or learn more about our community. The second point, that is recovery from addiction. Addiction often affect many areas of person's life. It is possible to return to a healthy life with the help of the appropriate behavior therapies, medication assisted treatments, exercise, and with a sense of a community. The most effective treatments are comprehensive. They often have several steps that vary from a person to person. These steps can include detoxification, behavioral counseling, and long-term follow-up. Support from family. Here are some ways that we can support our family or family members from recovery process. We have to learn more about the substance or behavioral dependency and treatment. We have to stay involved, like offering to go to meeting with them, providing a sober and trigger-free setting, then speak up and express concern when there is a relapse. While we can treat addictions in most cases, Someone with addiction must want to change or recovery to be successful. So this about this particular class video. Hope it was helpful for you. Please do subscribe to my YouTube channel, My Intuition, like the videos and share to maximum. Thank you very much for watching my video and have a nice day.